Good evening to all. The 26th medical term that we'll be discussing today is fibrin. As the name suggests, as you are aware, it's an insoluble, tough, elastic protein. Yes, your guess is correct. It is a component of a blood clot. It's a protein that helps in the blood clotting. So, by helping in blood clotting, it stops bleeding and thereby facilitate wound healing. So, this process that occurs in the mechanism of inflammation and also for new blood vessel growth. And what is new blood vessel growth known as? Yes, neo or angiogenesis, isn't it? Yes. So, who produces this fibrin? It's the liver. Well, not exactly the fibrin, but it produces an inactive protein called fibrinogen, which gets activated into fibrin. So, how is this fibrinogen to fibrin conversion take place? There are four stages. Initially, the precursor stage, that is the presence of the fibrinogen, the inactive protein or the insoluble protein, or then comes the activation stage where the fibrinogen is cleaved into fibrinopeptides by the thrombin. This is followed by polymerization where the soluble fibrinogen, so I need to correct myself. Earlier, it's as I restate again, the fibrinogen is soluble, okay, not insoluble, soluble, which becomes insoluble fibrin, right? Make sure you remember that. And then comes the stabilization process where the insoluble fibrin, along with platelets and red blood cells, forms a blood clot. And this clot gets stabilized by factor 13A. So, why do we need this fibrin? Obviously, to stable the plug, which is the in the process of stopping the bleeding, that is hemostasis. And in the wound healing, it acts as a matrix for tissue repair. And of course, in inflammation, it triggers the cytokine production. So, what happens to this fibrin after the wound is healed? Of course, it is broken by a protein called plasmin, and the process is known as fibrinolysis. But once you break, what you get? Fibrin degradation products or the D dimer. So, what is the clinical significance of this? Generally, a bleeding disorder would be indicated by less fibrinogen, or thrombosis indicated by high fibrin.